Detailing his harrowing experience while a patient at the Ocean View Hospital for 13 days was 54-year-old Dio Posad, who claims that he, along with other patients at the institution, were continuously served substandard food. The man, who was admitted at the hospital on March 22nd, said that for the first few days he spent at the institution, he was unable to eat or walk on his own due to severe symptoms he was experiencing. However, when he eventually developed the strength to grab a bite, the meals were bland.
And I think if the food they cook properly, you would have got some taste from the food.
Prasad further claimed that the meals are often untimely and cold, therefore compromising nutrition.
Get hot things and give the people, and if you can, get hot things to give the patient in the hospital. Let the people, family, them bring it for them.
The father is calling on the government to establish a kitchen at the hospital, which would ensure hot and quality meals are served to the patients.
If the government, they have big space in that compound, and if the government could build a kitchen and get cooks or other people and also assist the cooks them and get hot meals to the patient in that hospital.
When contacted for a comment on Prasad's claims, Shalana Providence, head of strategic planning and communications at the Georgetown Public Hospital Corporation, divulged that even though she is in receipt of several complaints about the poor quality of meals provided at the hospital, investigations have not substantiated claims that patients were not being fed.
Some of the patients are intubated. Some of them are on oxygen, so they cannot receive meals the way a patient who is not hooked up to a machine would receive meals, or a patient who is not intubated would receive meals. Some of them are being fed through assisted feeding, through the tube. Some of them are being fed, and like I said, I'm not an expert here, but there are other methods that are being used to provide nutrition for the patient.
Relative to the temperature of the meals being served, Providence disclosed that steps have been taken to guarantee consistent quality meals.
We have put systems in place by getting warmers, microwaves, and so forth, so that when the food arrives at the facility, it can be warmed up before the patients receive it. It is a continuous process, but we are trying our best to utilize this feedback so that the patients can have the best quality of food while they're at Ocean View.
The meals are not prepared on the premises since the existing kitchen is inoperable. With guidance from a nutritionist, they are prepared and brought to the hospital by a company which was contracted to do same by the Ministry of Health, Providence explained. Last month, Kenneth Blanc took to social media to highlight that he was being deprived of meals while a patient of the intensive care unit. His claims were regarded by the Ministry of Health as simply untrue. Timeka Rodney reporting for the HGP Nightly News.